Okay. Great. Okay, so it's on the hour. So welcome everybody, those who are joining us live and also following the event today, the webinar today. Just like to say a very warm welcome to everybody and thank you for taking your time out of your busy days to join us. On behalf of the Nurses Working Group for the International Society, we are really excited to bring you this presentation today from Telegenz. Before we start, just want to recognise my colleague Auti, who is another one of the members from the working group who's helped to put this together today. So really greetings to you live from Finland. So thank you for your support as always. And it's Auti that works behind the scenes along with Dr. Shriani and I to really move the forum forward for our nurses. So thanks again to you for joining us. And then excitingly today, our presenters. So we're delighted to welcome Dr. Maimoona from Telegenz and also Kerryn from Telegenz as well. So before we start, Dr. Maimoona, would you like to just introduce yourself and a little bit about your background and so forth? And then we'll do the same from Kerryn just to kind of set the scene for everybody so that they know who's who and what's going on today. So over to you, Dr.
Thanks a million, Kerryn, and thank you for the opportunity to share Telegenz through the International Society for Telemedicine and eHealth platform and the Nurses Working Group. It's an absolute honor. So about myself, I'm a doctor trained in general surgery and have been a clinical educator for the last 15 years at the Royal College of Surgeons in Ireland and University College Dublin here in Ireland. And lately, I have been involved full-time as the CEO of Telegenz, which is an AI-augmented platform for clinical training and assessment under human supervision and at scale. So we're very excited to share how that can be used in nurses' education. So I'll move over to Kerryn. Kerryn.
Thank you.
Hi, everyone. I am Kerryn Corrigan. My background is advanced nursing practice. I'm a nurse practitioner and have a doctorate in nursing practice as well. Most of my career actually was in America, some in Canada. I've been teaching for several years, and I work currently with Maimoona as Chief Academic Officer for Telegenz. And then I also do some advising for healthcare platforms and also for universities for programs. So I teach at universities periodically as well here in Dublin at the College of Surgeons and also Dublin City University. So I'm also honoured to be here today. Thank you very much for the invitation. And if you like, Kerryn, I'll go ahead and start.
Yes, brilliant. Please take it away. Thank you.
Okay, so I'm going to talk about reimagining patient care, integrating a digital health connection beyond hospital walls. And it's not moving for me. Oh,
there you go.
sorry, there it is. Okay, sorry, but that's always the way, isn't it?
Yeah.
So we look at the hospital at home model of care, the multidisciplinary team, the purpose-built platform, Telegenz, and then also practitioner and patient training. So the World Hospital at Home Scientific Committee define hospital at home as an acute clinical service that takes staff, equipment, technologies, medication and skills usually provided in hospitals and delivers that hospital care to selected people in their homes or in nursing homes. It substitutes for acute inpatient hospital care. The goal of hospital at home is to improve the lives of sick people who need hospitals by changing the culture of hospitals to deliver hospital level care at home. So the model then, the hospital at home is subject to regulatory and governance obligations, and it's directed by a care hospital and or specialist physicians within the hospital. It's episodic, meaning it has a beginning and an end. It's 24/7 service. And with that service, the healthcare team are fully responsible for the patient. They provide all medical, nursing, allied care, observation, diagnostics, and therapeutics during the episode at home. So what it is not then would be what we're familiar with, like outpatient care, such as self-administered IV treatment, and it's not outpatient parenteral antimicrobial therapy. It's not a hospital prevention program, a community-based chronic disease management program. It's not solely virtual care or remote telemonitoring that we'd be familiar with, not day facilitated based treatment. It's not a primary home care, and not community nursing or standard skilled home care. Skilled home care is actually much more than that. So research published in JAMA, the Journal of American Medical Association, confirms that hospital at home can be safe and effective for appropriate populations while improving the patient experience. So conditions then eligible for that are both acute conditions and acute exacerbations of chronic illness. And here's some examples: pneumonia, exacerbation of COPD, endocarditis, postoperative management, the vacuum-assisted closure wound therapy, cellulitis, osteomyelitis, cystic fibrosis, urinary tract infections, total parental nutrition, IV hydration, and iron infusions. And this list is actually taken from the Voluntary Health Insurance Hospital at Home in Ireland. Now, hospital at home is a direct substitute for inpatient hospital stay with multidisciplinary care. It makes clinical sense because many patients can receive safe, high-quality acute care in their own homes while avoiding some hospital association harms, such as deconditioning, infection risk, sleep disturbance, and loss of independence. So international evidence shows that hospital at home provides outcomes comparable to inpatient care, with consistently high patient satisfaction as the patients value dignity, comfort, and staying connected to family while receiving hospital-level treatment at home. Patients should consent to hospital at home care and be allowed to withdraw that consent, but more importantly, if they withdraw that consent, they have the right to a hospital bed. Hospital at home is about reimagining care delivery, and digital technology is essential for effective collaborative partnerships with patients and practitioners, meaning the multidisciplinary team. Connection between patients and the multidisciplinary team builds trust and improves coordinated care delivery. For collaborative practice, the World Health Organization recommends relocate and rearrange equipment to better facilitate communication flow. And for the hospital at home model, an effective digital workspace is necessary. Remote monitoring, shared records, dashboards, alerts, video review, and messaging systems must be deliberately designed to support multidisciplinary team communication and patient safety. So the aims of this initiative then are to facilitate multidisciplinary team and patient communication flow within the hospital at home model of care using a purpose-built platform, Telegenz. Telegenz helps to move hospital at home beyond a video consultation. For clinicians, they learn communicating and documenting digitally, supporting patients remotely, developing remote clinical reasoning, teaching through structured digital sessions, collaborating across the multidisciplinary team. For patients, they learn communication with the multidisciplinary team, using digital tools and devices confidently, engaging in monitoring and self-care, recognizing symptoms and knowing when to escalate, and participating actively in home-based care. It recreates a structured digital environment where clinicians can teach, document, communicate, and support patients, while patients learn to use digital tools, engage in monitoring, and remain linked to the multidisciplinary team. And Telegenz, I just want to mention, is GDPR and HIPAA compliant. So digital technology then is a bridge to hospital at home. It connects patients and clinicians in real time, enables structured assessment beyond physical settings, and supports early identification of deterioration. It sustains continuity and quality of care at home and aligns with global digital health strategies. And the alignment with global digital health strategies indicate that the initiatives must be guided by a robust strategy that integrates financial, organizational, human, and technological resources. In effect, digital tools transform the home into a supported care environment. However, the biggest barrier isn't the technology itself, rather it is its usability. Tan and colleagues in Singapore, in their recent systematic review, indicated that skills training and patient training and education can affect the overall effects of technological interventions. That's why digital technology is so important. So to prepare the workforce for hospital-at-home care, we need digital platforms to accommodate clinician and patient education and support. For clinical training, Telegenz supports device education skills, digital communication, remote efficient clinical decision-making. And then for patient as an empowered partner, Telegenz supports smart device guidance, real-time monitoring skills, and direct care team connection. Within a hospital-at-home model, Telegenz can support both clinician readiness and patient confidence by providing a structured digital environment for communication, education, monitoring, and collaboration. Telegenz helps move hospital-at-home beyond a video consultation, for instance, facilitating a structured history and physical exam where clinicians and students follow a systematic approach to history taken and guided observation, patient participation, remote review, and multidisciplinary input for elements of the physical exam, all possible simultaneously within one shared digital space. It can support virtual OSCEs, the objective structured clinical exam, integrate telehealth and remote monitoring by bridging together communication, clinical review, patient education, digital documentation, and multidisciplinary coordination within a structured digital environment. Telegenz has the capacity for multilingual functionality to support equity and access as well. So I just want to say these slides here are shown with permission. Here we can see the structured approach of simultaneous clinical teaching with good clinical documentation practice. Structured sessions support guided learning and clinical interaction, facilitating consistent education delivery, supervised practice, and real-time clarification for the trainees. Students learning through the hospital-at-home virtual clinical placement can be assessed using the assessment modes, which enables clinicians to evaluate understanding and technique remotely, and can also support patient assessment, such as virtual OSCEs, entrustable professional activities, screening programs, and even research. Again, all within the same environment. The literature supports improved patient digital health literacy, enhanced self-management, and stronger communication of care between patients and care teams. Importantly, digital tools function as facilitators of response and empathetic care, supporting relational practice while simultaneously building workforce capacity through clinical education. By embedding digital literacy and structured education into hospital-at-home programs, we have the opportunity to create a model that balances innovation with empathy and one that strengthens the clinical-patient relationship. Digital tools become enablers of more frequent connection, more responsive care, and more empowered patients. So in closing then, using a learning digital platform for the hospital-at-home model of care is not simply a service redesign, rather it is a learning system. And also this platform could be used to serve to increase the clinical site placement availability when clinical sites for students studying within the healthcare field are scarce. So that's all from me. Thank you very much.
Thank you very much, Catherine. I mean, it's a fascinating area and so revolutionary, really, isn't it, for patients to be able to access care. I have popped in the chat if anybody on attending today might have any questions, so feel free to pop a question in there, or if you would like to ask any questions, please do raise your hand as well, and we're very happy to take them. Just give everyone a second.
Thank you so much for your presentation. While the others are thinking and maybe writing, I just would like to say that I was yesterday with my godfather over 90 years old, and he was having the home health care and the home hospital care. And I was so glad that he could stay home with the late cancer situation. So I
Oh,
really much appreciate this. Uh, I just wanted to say that to you, that it's very effective work what you do, I think also in Ireland.
oh,
But
it's so
at the same time, I understand that there is those elder people, and then of course the many kind of other patients like you described already. But that I was thinking that what like you mentioned that the patient skills, do you think they are very effective? Is it more about the professional skills or about patient skills?
Oh, it's actually both. It's actually both.
Mm,
It's about, patient communication. It's about the communication really,
yeah,
but
yeah,
also the teaching. But the teaching
yeah,
of both, yeah, because to get the professionals confident in using the platform, and then also with patients that they know
yeah,
that they can, communicate effectively and with the professionals as well, and learn whatever they need to learn for that period of time that they have the hospital at home.
yeah, yeah. Because I think that so I'm from Finland, and I think and for here, like I was looking after that, we have the home health care and home hospital care association, but sorry, the pages were only in Finnish.
Mhm.
But there is sort of it's a very important and I think even more and more growing part of healthcare in the future.
Oh yeah, very much so. And it just relieves the hospitals, and there's not that much research done on this, but on the patient satisfaction part,
Mm,
I really like it, which, just makes perfect sense that people just want to be at home in their own environment, it just you're feeling bad and you go in the hospital then as well, and you're taken everything is just upside down. You're taken out of your environment, you don't feel good. So
mm,
being able to stay at home and having the support of the
mm,
family, and that support team around is
mm,
paramount.
And then when now we are on the digital care part, sort of somehow that how we could develop as good tools who would can support patients and communication with them with home healthcare professionals and patients. I think that's very important work what we are doing in this digital care part.
Very good. Yeah, yeah. It's some multidisciplinary team approach as well. If they, however they just the hospital at home decide to manage it, if they decide
Mm,
to have meetings or whatever, it's just that everybody can hop on, and then, Dr. Maimoona will demonstrate how the documentation can be done there, and how you can even, silence one person, and then, you and I could talk maybe, if we wanted to just review part of the documentation or something, and then go back to the patient afterwards. And it works very well, very efficient.
yeah, I believe so. Do we have some questions with the audience?
Not very quiet out there, it looks. So, at any point, if you do have any questions, feel free to put them in. But
Would be
Kat,
also,
mhm,
Kerryn, I think what if you don't want to ask, would be also nice if you can write and then also write a bit which kind of countries you are. That's also could share us the great platform to discuss on later after the next presentation. Sorry,
yeah,
Kerryn, I
no
I can
worries.
stop sharing.
jump on you.
Thank you. I maybe just had one question. You mentioned as well about using it for training and to support OSCEs. Would you mind to tell us a little bit about that as well, how that works?
Yeah, they, the let's say there's a patient at home somewhere, and they give permission that the instructor can that the student that an instructor and a student can come and see them there, or the student can visit them for maybe at the end of wound care or something, and the student is needs to do some placement, then I could get on remotely from the university as the instructor, and they can demonstrate everything for me on the
Mm.
ask.
Oh, very good. Oh,
Yeah.
very interesting. Yeah, it's a really, really interesting platform, that's for sure. But
Well,
no,
yeah,
that's
that
great.
I used to visit the students when I worked in Detroit, and in the wintertime, the snow and ice. And I thought, I was discussing this with Dr. Maimoona, it would have been lovely to have this to be able to do OSCEs remotely, because we would have to drive maybe, 30, 50 kilometers to where their little placement was in whatever clinic, and do the OSCE there with them, so it would have been really nice if we had it.
Yeah, save a lot of driving around. Yeah.
Yes, yeah.
Gosh. We do have a question actually from Frank as well. Thank you, Frank, who has said, is this platform currently being used in real world operational settings, or is it primarily for training and educational purposes?
Yeah, Dr. Maimoona will be able to expand on that some more, but I know it has been used. There she is. I'll hand over to you for its use, Dr. Maimoona.
Thank you.
Did you hear the question?
Hi. So, yes, currently it is for the education and training purpose, but we are in talks with stakeholders who would be expanding it into actual practice. In the capacity of research, it is part of hybrid model of care at a research project here in Ireland at Mullingar Regional Hospital. And that's in the space of neurodevelopment clinics in pediatrics. So not precisely hospital at home, but as part of virtual care, hybrid model of care. So, yeah.
Brilliant. Thank you. Thank you very much. Thanks. So I think it's a good time to hand over to you, Dr. Maimoona, to do the demo part of things as well. Thank you.
Thanks very much, Kerryn. And thank you, Catherine, for a great presentation. I'd just like to share my screen here. Are you able to see my screen?
We can. Yep, we can. That's perfect. It's just the one presentation mode. Good to go.
Great. All right. Thanks very much for this opportunity. As introduced earlier, my name is Maimoona. I'm the founder and CEO of Telegenz, and with my clinical education background and background as a software developer, I'll be able to take all your questions related to the anticipated use cases. But it's an absolute honor to share this platform, Telegenz, with you all today. Telegenz primarily is a content-agnostic infrastructure augmented by AI features to facilitate clinical educators and practitioners in simultaneous patient care and capacity building. So in the context of hospital at home care, which Catherine has very well elaborated on, Telegenz supports the care providers and health systems on three fronts. So number one is the onboarding of the staff. So all the time there is new staff coming in, and then we need to keep up with the CME, the continued medical education of the staff, which is already on board. Then at times, one needs to connect with the multidisciplinary team while providing patient care at patient's home, be it in the presence of a nurse or a social care worker present physically with the patient, or the patient actually accessing virtual care with the care providers. In either case, Telegenz supports that. And then there is a need for expanding on workforce capacity building across the board, across all healthcare disciplines, considering that the WHO has estimated a shortage of 11 million workforce by the end of 2030. So it is an urgent need that we all need to cater towards. And we are honored to be positioned and to be able to facilitate this capacity building. So first of all, I would talk about the onboarding of new hospital at-home staff. Like I mentioned, I'll be showing you the actual demos. I wouldn't be spending a lot of time showing you and talking through the slides, but just to set the scene, in the onboarding scene, obviously, new staff comes in. Some of them may be familiar with virtual care. Some of them may not be familiar with virtual care at all. There was a question earlier about patient education. So yes, patient education is extremely important when it comes to leveraging the exponentially growing technology around us, because this is something which can significantly improve their quality of life. And it is down to us being able to educate both the care providers as well as the patient to fill this digital health skills gap. So coming to the onboarding of the new staff members, whichever healthcare discipline it may be, these staff members need to be trained in the skill sets, which would involve using the technology itself, so the technology skills, but also patient care skills. In remote patient assessment has been recognized as a different skill set in its own right. So it is important that they are familiar with how they can leverage various digital health technologies, medical devices that may be present at patient's home, how they can leverage data and actually inquire about the data from the patient whom they are seeing virtually. So that is the onboarding of the staff, which again can be done with the real patient scenario on Telegenz. So basically somebody actually visiting the patient in their home and connecting with the new staff members for onboarding, or the CME team going for their CME modules. Or it could be a totally simulated environment where we have synthetic electronic health records as well as ISfTeHs to practice with. Then there are scenarios where the nurse or the social care worker who may be visiting the patient in person after an early discharge from the hospital would need to actually liaise with multidisciplinary team. And that's where Telegenz facilitates all of that in one simple platform, allowing everybody to document, contribute to electronic health records. We support interoperability and can connect with the local electronic medical record systems present within a particular health system. So again, the question that came back earlier, whether it is suitable for real world settings, it absolutely is built in such a way that it can seamlessly integrate into all the systems that are already present in the hospital, so that none of the communication effort is lost, and the experience on the platform is as time efficient as possible. So what happens there is the multidisciplinary team can share their documentation, the nurse can make notes, advise the patient through the virtual platform, and also we could have new staff member or even trainees who are looking for their clinical placements can avail of this opportunity. Clinical placements at this point in time are a huge bottleneck. The university programs in health professions world across the globe are facing immense pressure to scale their programs. However, the clinical training sites are not scaling at the same pace. And also there is a difference between private health systems and the teaching hospitals in public health systems. Students don't always get access to real patient. And that's where any such platform which allows for consented reach out and access to the real patient is highly valuable. So that brings me to this slide where you can see how simultaneously patient care in both virtual and in person can be delivered while actually training people from different healthcare disciplines at the same time. So this simultaneous access to the patient in terms of care and clinical training makes it a very time-efficient process. Now, none of the training exercises would be complete without assessment. So when it comes to the certification of your staff members who may be, doing it for onboarding or again for CME, then they can be certified through the virtual assessment platform, which is again AI augmented, assists the human supervisor. So there's always a human in the loop, whereas that person is always being supported with the best of AI capabilities to reduce the overall burden of training and the stretch that the healthcare system is currently facing. So now I will move to the live demo, if that's okay. Do you have any questions for me at this time while I move on to the other screen to share the live demo with you all?
I can't see any written questions, but is there someone? would like to ask for now?
Feel free to put up your hand if you do, and we can get the question from you live as well.
Yeah. Okay, let's continue.
All right, just bear with me for a second, please. Are you all able to see my screen?
Yes.
All right, so this is the screen that you normally see once you log in to the Telegenz platform. You can see all your scheduled appointments, any notes from the previous session. For people who are undertaking a training, they would be able to view any resources they should see ahead of seeing this patient. So those resources are available to the learners before and during the session and even after the session, along with the session outcomes. So I'm just going to join this session now. As you can see, I'm joining in as the care provider, and I will be undertaking patients' confidentiality and autonomy. They should consent to taking part in this exercise. And if the patient were to log in without the presence of any nurse visiting them at their home, or without a social worker's presence who are actually enrolled on the system, then they would be logging in using their own credential and signing a consent which stores against meeting ID to make it all in line with the requirements. The platform itself is compliant with data obligations globally, so we cater to regional requirements. It is GDPR and HIPAA compliant. I'll just select one of the synthetic electronic health records to show you how we can actually train, especially in terms of onboarding, without putting any patient data at risk. So where there is no integration with the real patient data, in that context, electronic health records can actually be used, which are generated by AI and are context aware. So I hope you're able to see my screen now. What you're seeing here is myself. I have my multidisciplinary team joining me in here. Dr. Kerryn Corrigan will be joining us here as well shortly. So in the bigger screen that you're seeing here would be where the patient would be, and we could have a focused inspection of this post-surgical scar here. That's the post knee replacement surgery, 7th day post-op, and let's assume the nurse has actually gone to visit patient. She's showing us the scar. We have multidisciplinary team here. If I wanted the physiotherapist to take over and inform the patient about any mobilization or other instructions that they might need to give, I would spotlight them, give them the opportunity to actually speak with the patient in that context. And when we have multidisciplinary team logged in here, what happens is the patient might not prefer to see so many people on the screen, but for sake of transparency, in the participants list, they will be able to see all the people who are actually online and engaging in this particular exercise. However, we could have this focused view where I'm able to actually see exactly what I need to see, and the patient as well is able to see only the person who is actually actively speaking to them. So this is the video side of things that we have got. In the notes-taking area, this is totally free of AI, so completely your own thoughts, what you want to document, what instruction you want to give to your patient. System generates a PDF, and that can be sent to the primary care provider, or it can be sent into the hospital's electronic health records. In the file section, I'd like to show you how basically we can access synthetic electronic health records. And let me show it to you on a bigger screen here. You would be able to get all AI-generated synthetic electronic health records for teaching purposes. And in the transcript, we have support for 143 languages and dialects. which allows for engagement with a diverse cohort of patients. In community settings, this particular feature will be used to train community health workers in a mental health intervention. And these community health workers would be trained by Professor Farhana Sharif, who's actually based here in Ireland. She's a consultant pediatrician and has designed this novel intervention for the emotional, behavioral, and mental well-being of children. So this language support is extremely beneficial for that. In resources, again, learners would be able to access their learning materials. If there are any patient notes that need to be accessed, they can be accessed here. And we have Terra integration, which would be able to access data from patients' wearable devices. This is dummy data just for your interest here. But this is how the data from patients' wearable devices would appear here. So this is the training mode. In assessment mode, instead of these notes, you would be able to see the OSCE sheet. So it would be a marking sheet for the examiner, and then there would be an AI auto assessment. I wouldn't be able to switch right now in between the two modes to be able to show you that. But just for your understanding, instead of the subjective notes, you would have a marking sheet in this area. So this is these are the key features. Of course, there are several other features, but in the interest of time, I would like to stick to what's most relevant. And I would love to hear any questions that you may have for me now. Thank you.
Would you like to ask some questions with the audience or from audience? At least me as a teacher on my daily work, this is very, very interesting. And I would like to know that how many schools are using this in Ireland? Is there?
So there are university programs. They have, so it's the RCSI School of Physiotherapy, for example, has used it for 5 years in a row. School of Medicine used it in their graduate entry medicine program during the pandemic. And as and when it becomes part of the curriculum, we would be in talks again. Dublin City University actually used it in their master's for advanced practitioners programs. It was a chronic disease management program in which they had telehealth module, and they used this platform for the training of nurses. So these are the key ones, but we are currently also expanding into the GCC countries. So in the UAE and Saudi and Qatar, where we're in advanced talks with university programs. Our key use case at the minute, which is gaining most interest, is the interprofessional education, because again, the capability to bring in multidisciplinary teams into the platform, because just coordinating the schedule between multiple disciplines is such a huge challenge. So, bringing them into a physical space is an even bigger challenge, and it is a strategic priority, national priority for several regions and countries. So that's something which is gaining most interest for us. And that aligns very well with the hospital at home program, because that opens a new avenue for clinical placements. And that could ease so much pressure on the programs which are looking to actually scale the number of students they onboard.
Because there's different kind of communication during those platforms than to see in the real life. And then on the way, I was also thinking the same. What there is, the Fatima is asking at any South African or African languages included, and I was also thinking that maybe not yet, but would it the future, could there be some other languages than English?
So we have support for 143 languages and dialects on our platform. And what we are using is Microsoft's pre-trained AI model, which allows us to inherit as and when that model matures itself. So we do have support for these languages. Fatima, I'll have a precise check and get back to you if that's okay. But I believe that there would definitely be a support for, we do have support for most of the sub-Saharan languages. It was of concern to us because that's where our community-based initiatives are actually scaling. So
Thank you.
Incredible. Well, thank you so much, especially the live demo and the depth of quality of the images that you could see as well. It's a really interesting, really fascinating model. But thank you. Thank you very much to both you and Catherine today for such a fantastic presentation. I think if there are any other questions that come up after, please do, don't hesitate to reach out to us as well. We have recorded the session, so I imagine often what happens is when we release that, we get questions afterwards. So most definitely we'll keep in touch with you both with anything else that comes forward. But, really interesting and fascinating presentation, and very much appreciate you sharing with our group today. So that's Artie. I don't know if you had any final kind of parting thoughts as well before we wrap up the session for today.
I also just want to thank, there is some now, the questions coming.
Here they come. Yeah.
Or Frank, could you even make your questions as a loud question, or do you want us to read? I can also read that. My first question is whether please, Frank, that's nice if you can have your own words.
Hello?
Hi, Frank. Hi there, Frank. Thank you so much for asking the big questions. We've got you on speaker now.
Sorry, I tried to separate it into 3 sections. First of all, I want I think this system designed for aftercare on something like follow-up, or actually this is for care delivery, because we have 3 sections in care: before care, care delivery, and aftercare. It seems that this is for aftercare. Am I right?
So, Frank, thanks very much for asking these amazing questions. So it is actually Telegenz is an infrastructure. You could use it where you see it fit. It can cover all 3 phases. So technically, what you saw just now, obviously, we didn't have a real patient available to us right now. And what we used was an image to show you a very focused scar, and just, it would help you imagine how it would happen in real life. But I appreciate where you're coming from. Ideally, of course, you'd first see the patient, you'd take history, and then you will move on to the various aspects of that particular clinical interaction. So again, it could be the very first presentation. It could be in the hospital at home perspective and context. Of course, it would be after care once the patient has been sent home. But hospital at home is not the only use case, if that answers your question.
Yeah, and what is the other use cases?
So the other use cases would be just simple virtual care clinical training. So there are institutions and organizations who like to offer training to their students or to their employees in virtual care. So you could actually use it for the education and training in virtual care. Again, there are other use cases involving shortage of clinical placements. So to maximize clinical exposure to the students with real patients and in real clinical settings, this has been used by MOHAS in Tanzania to actually address the shortage of clinical sites. So they have lots of students and limited clinical sites for training. So the way it was used and trialed was that there were 5 students who were present on site, and the other 5 attended the placement virtually, and the next week they swapped. So that allows it is purpose-built for clinical training. So obviously that can be done. And then electronic health record, it's not always the easiest to integrate with every health system's electronic health record, because there's a lot of regulations and legislations involved, which becomes a barrier in clinical teaching. So we have AI-supported electronic health records, which are synthetic but context-aware. So students could still go through the clinical reasoning exercise and use it for that. Interprofessional education is another use case. Again, it's a priority in the universities across all regions. So these are the few use cases to suggest. And I mentioned the hybrid model of care during my presentation. So that one is a virtual appointment being sandwiched between two in-person appointments. But during the virtual appointment, there are also medical students joining the professor. And so they get their clinical learning while the professor provides patient care to the patient.
Yeah, thank you. I don't know how much time did I have. I don't know. I have
You can
time.
ask another question. Yeah, you can ask something else.
Thank you. It seems that this is like something like education or maybe a clinical trial simultaneously, but in the clinical trial, the eligibility of the acceptance of the patients to the clinical trial is an important phase that I didn't see in your process. I think there is many barriers for you to come to the care delivery. So it seems that you try to penetrate to the market. It is very smart way that using education to penetrating to the system, but in front of you there is a long way, maybe 1 year, and much money for CEMDR, because deciding about the scar, deciding about the complex situation that happens, that the nurse faces, maybe need to deciding remotely, and this is clinical decision making. Yeah, faced to the CEMDR, I think, and it is differ from video visit, video call, and something like this. A need to validation, and yeah, this is a big barrier for every systems to have a pilot. It seems that you are successful to have a pilot in a hospital. I want to know that what your plan for the future, and what is the second step, because this is not education system. This is something like clinical trial. This something between real setting of the care and educational. I'm confused about it. I can't. What is the actual position of the system now?
Let's hear what is Maimoona is answering to you.
Yes.
Yeah.
So no, thanks for sharing your thoughts there, Frank. Appreciate that. And just to clarify, we have already, we are way past proof of concept. It has been validated across several healthcare disciplines. So physiotherapy, medicine, pharmacy, and nurse education, to name a few. And that's why, you know, in interprofessional education, we are gaining a lot of interest from various educational programs. So the niche that we have positioned ourselves in is workforce capacity building, because that itself is a big enough problem for us to solve. And considering my own skill set as the founder in this particular domain, I think this is where I'm, best suited to lead and to make a difference. With regards to scaling it into services delivery, yes, the platform is very much capable of scaling into the services delivery, along with collaborations and integrations with the pre-existing systems. But we have positioned ourselves as collaborators with the existing virtual care platforms rather than being a competition to them, because there are beautiful virtual care platforms out there in the market. Plenty of them. There was no point in us reinventing the wheel. I have brought my domain knowledge in clinical education and software development to actually solve a problem which existed, and there wasn't a purpose-built platform to support that. There are so many clinical education and training platforms out there in the market which are specific to disciplines. And then there are lots of limitations around them. They're all fragmented tools. Telegenz is not a fragmented tool. It's an infrastructure that can accommodate all of that in one place. Clinical trials. So basically, we are currently exploring the validation use case for training of healthcare providers and how to run clinical trials, because we are an infrastructure, we are content agnostic, we are not restricted to a particular discipline. So it can technically be used even outside of healthcare for that matter. So in clinical trials perspective, where we have our exam mode can actually be the clinical research pro forma. You could do your consent training there, you could do your clinical trial virtual interviews with the patients there. It can actually support qualitative and quantitative studies both, and even mixed method research. So the use cases are actually down to the creativity of the user, because the platform is capable of all these. It's not something set in stone where we define how you use us. It's actually a platform which adapts to your needs. And that's the feedback that we have got from all the users we have on board in the US, in Ireland, and in the UAE at the moment.
Brilliant.
Thank you
Well,
so
thank you.
much.
Thank you, Frank.
John, I admire the system, so very, very good. And
Thank you.
yeah, I'm excited about it. Yeah, thank you
Yeah.
so much.
Thank you so much. Thank you.
Thank you. Thanks, Hugh. So I think that nicely brings us to the end of the session. And once again, really impressive system, and appreciate both of you sharing this with everybody today. So thank you everyone for joining, and also to Dr. Maimoona for presenting, and also to Kerryn. And we'll be stay tuned for the next webinar, which we'll be holding in the next month or two. So look out for next dates for next features as well. But I hope everybody has a great day, morning, afternoon, wherever you are, and we will see you all very soon. Thank you, everyone.
Thank you.
Thank you. Thank you for the
Bye-bye.
opportunity.
Bye
Thanks.
bye.
Bye-bye. Bye.